A man ate 50 vitamin D pills every day. This is what happened to his kidneys. Teddy is a 58-year-old man who works as an accountant. He's generally health conscious, goes to the gym 3 times a week, Teddy's his diet, and takes his supplements religiously. One morning, Teddy was reading a health blog about vitamin D deficiency. The article claimed that most people don't get enough of the sunshine vitamin, and that higher doses could boost immunity, strengthen bones, and even prevent cancer. Teddy had just gotten his annual physical, and his doctor mentioned his vitamin D levels were on the lower end of normal. Teddy thought to himself, if a little is good, more must be better. He went to his local pharmacy and bought several bottles of vitamin D3 supplements. Each pill contained 1,000 international units, the standard dose. The bottle recommended 1 pill per day. Teddy had other ideas. He started taking 10 pills with breakfast, then 10 more at lunch, then 10 at dinner. And before bed, he'd take another 20, just to be safe. That's 50,000 international units of vitamin D3 every single day for 6 weeks, presenting to the emergency room with extreme fatigue, uncontrollable thirst, and confusion. When Teddy arrived at the ER, he could barely stand. His wife had driven him after finding him disoriented in their living room, unable to remember what day it was. The triage nurse noted his vital signs: blood pressure, 165/95, elevated. Heart rate 110, tachycardic. He was breathing rapidly. His skin appeared dry and pale, and when asked to describe his symptoms, he slurred his words. "I can't stop drinking water," he told the ER physician. "But my mouth is still dry, and I'm so tired. I can barely think straight." The physician ordered a comprehensive metabolic panel, a blood test that measures electrolytes, kidney function, and other critical markers. When the results came back 45 minutes later, the attending physician's eyes widened. Teddy's serum calcium level was 15.2 milligrams per deciliter, normal range 8.5 to 10.5. This is hypercalcemia. Hyper meaning excessive. Calc, from the Latin for lime or calcium. Emia, meaning presence in blood, excessive calcium presence in blood. But calcium doesn't just become elevated randomly. The team needed to find the source. Let's talk about vitamin D and why Teddy's body was falling apart. Vitamin D isn't actually a vitamin, it's a prohormone. When ultraviolet B radiation from sunlight hits your skin, it converts 7-dehydrocholesterol into cholecalciferol, also known as vitamin D3. This same compound is what Teddy was swallowing by the handful. But vitamin D3 isn't active yet. It travels to your liver, where it gets hydroxylated, meaning an OH group is attached, becoming 25-hydroxyvitamin D, or calcidiol. This is the form doctors measure when they test your vitamin D levels. Then, it goes to your kidneys. Here, another hydroxylation occurs, creating 1,25-dihydroxyvitamin D, called calcitriol. This is the active form. And calcitriol has one primary job: increase calcium absorption from your intestines. Under normal circumstances, this is good. Your bones need calcium. Your muscles need calcium. Your nerves need calcium. The system is elegantly regulated. Your body produces exactly as much active vitamin D as it needs. But Teddy wasn't operating under normal circumstances. At 50,000 IU per day, Teddy was consuming 125 times the recommended daily allowance. His liver was overwhelmed, converting massive amounts of vitamin D3 into calcidiol. His kidneys were working overtime, producing dangerous levels of calcitriol. And his intestines? They were absorbing calcium like a sponge. All that calcium had to go somewhere. In the ER, Teddy's confusion was worsening. He was having trouble staying awake. The medical team recognized this as altered mental status, a neurological emergency that could indicate his brain was being affected by the calcium imbalance. They ordered an EKG, an electrocardiogram measuring heart electrical activity. The tracing showed a shortened QT interval. The QT interval represents the time it takes for the heart's ventricles to contract and recover. Excessive calcium accelerates this process, and in severe cases, can cause fatal arrhythmias. Teddy's heart was becoming electrically unstable, but the most concerning finding was his kidney function. His creatinine level, a waste product that healthy kidneys filter out, was 3.8 milligrams per deciliter. Normal is 0.7 to 1.3. His blood urea nitrogen was 62. Normal is 7 to 20. Teddy was in acute kidney injury, bordering on kidney failure. The nephrologist, a kidney specialist, was called to consult. After reviewing Teddy's case and taking a detailed history, the culprit became clear when Teddy's wife mentioned the vitamin D supplements. "How many does he take?" the nephrologist asked. He takes a lot," she admitted. "Maybe a whole handful, multiple times a day?" The team immediately ordered a 25-hydroxy-vitamin D blood test. Normal levels are 20 to 50 nanograms per milliliter. Optimal is around 30 to 40. Levels above 150 are considered toxic. Teddy's level was 384 nanograms per milliliter. This was severe vitamin D toxicity, causing hypercalcemia, and that hypercalcemia was destroying his kidneys. Here's what was happening inside Teddy's body at the cellular level. Your kidneys contain about 1 million nephrons each, tiny filtering units that clean your blood. Each nephron has a glomerulus, where blood is filtered, and a tubule, where the filtered fluid becomes urine. When calcium levels in blood become excessively high, several catastrophic things happen. First, hypercalcemia causes vasoconstriction, narrowing of blood vessels, in the kidney. This reduces blood flow to the nephrons, starving them of oxygen. Ischemia, meaning inadequate blood supply, begins to damage the delicate filtering apparatus. Second, the excessive calcium begins depositing directly into kidney tissue. This is called nephrocalcinosis. Nephro meaning kidney. Calcinosis meaning calcium deposition. Calcium crystals form in the tubules, in the interstitium, the space between structures, and even in the blood vessels themselves. These crystals are like broken glass inside your kidneys. Third, the high calcium triggers a chain reaction. It activates calcium-sensing receptors in the nephron tubules, which causes them to reabsorb less water. Teddy's body was trying to dilute the calcium by making him urinate more. That's why he was so thirsty. But he was also becoming dehydrated, which concentrated his urine, allowing even more calcium crystals to precipitate out. The damage was accelerating. His nephrons were clogging with calcium deposits. Inflammation was spreading. Scar tissue was forming. And with each passing hour, more nephrons were dying. If this continued, Teddy would need dialysis, possibly for the rest of his life. The treatment had to be aggressive and immediate. First, the team started aggressive IV fluid resuscitation, pumping normal saline through Teddy's veins at 200 milliliters per hour. This would dilute the calcium in his blood and help his struggling kidneys flush it out through urine. Second, they gave him calcitonin, a hormone that opposes the action of vitamin D by promoting calcium deposition into bones and reducing calcium reabsorption in kidneys. Within hours, his calcium started to drop. Third, they administered bisphosphonates, medications that prevent bone breakdown and further calcium release into the bloodstream. Fourth, they gave him furosemide, a loop diuretic that increases calcium excretion in urine, but only after ensuring he was well hydrated. And most importantly, they told him to stop taking vitamin D immediately, forever, unless under strict medical supervision. But here's the problem. Vitamin D is fat-soluble. Unlike water-soluble vitamins like vitamin C, which your body can quickly eliminate, vitamin D dissolves in fat tissue and accumulates. Teddy had been megadosing for 6 weeks. His fat stores were saturated with it. Even after stopping the supplements, it would take months, possibly over a year, for his vitamin D levels to normalize. The damage was already done. Teddy spent 5 days in the intensive care unit. His calcium gradually decreased, 15.2, then 13.8, then 12.4. His kidney function stabilized, though not at baseline. His creatinine remained elevated at 2.1, indicating permanent kidney damage. On day 6, he was transferred to a regular medical floor. He could speak clearly again. The confusion had lifted, but he was weak, exhausted, and facing a difficult reality. The nephrologist came to his room with the follow-up labs. Teddy's estimated glomerular filtration rate, a measure of kidney function, was 38 milliliters per minute. Normal is above 90. Teddy had stage 3 chronic kidney disease. "Your kidneys have been permanently damaged," the nephrologist explained. "You'll need to follow a kidney protective diet, low sodium, controlled protein, careful monitoring of phosphorus and potassium. You'll need regular blood work, and you can never take high-dose vitamin D again." Teddy was discharged on day 8 with a thick packet of dietary restrictions, a schedule of nephrology appointments, and a very expensive lesson about the dangers of megadosing supplements. So what's the broader lesson here? The supplement industry is a $177 billion global market, largely unregulated. Unlike prescription medications, supplements don't require FDA approval before being sold. Companies can make broad health claims with minimal evidence, and consumers, people like Teddy, often assume that because something is natural or sold over the counter, it must be safe. This is catastrophically wrong. Vitamin D toxicity is rare, but it happens. A 2022 study in the British Medical Journal documented a case nearly identical to Teddy's. A man who took 80,000 to 100,000 IU daily and developed severe hypercalcemia, kidney failure, and required months of treatment. The Endocrine Society recommends no more than 4,000 IU of vitamin D daily for adults without medical supervision. Even that's higher than most people need. The tolerable upper intake level, meaning the maximum amount unlikely to cause harm, is generally considered to be around 10,000 IU daily for short periods. Teddy was taking 5 times that amount, every day, for weeks. Here's what you need to understand about fat-soluble vitamins, A, D, E, and K. Your body can't quickly eliminate them. They accumulate, and at high doses, they become toxic. Vitamin A can cause liver damage and birth defects. Vitamin E can increase bleeding risk. Vitamin K can interfere with blood thinners. And vitamin D, as we've seen, can destroy your kidneys. The irony is that Teddy's vitamin D levels before supplementation were fine. They were just on the lower end of normal, which is still normal. Most people in temperate climates have somewhat lower vitamin D in winter. This is a natural variation, not a disease requiring treatment. The best way to maintain healthy vitamin D? Spend 10 to 30 minutes in midday sun several times per week, depending on your skin tone and latitude. Eat fatty fish, egg yolks, fortified dairy. And if you do supplement, take the recommended dose, typically 1,000 to 2,000 IU daily, not 25 or 50 times that amount. 6 months after his hospitalization, Teddy returned for follow-up. His vitamin D level had finally decreased to 97, still elevated, but no longer in the toxic range. His calcium was normal, but his kidney function hadn't improved. His GFR remained at 36. He had lost approximately 60% of his kidney function, permanently. The nephrologist told him that if his kidney disease progresses to stage 5, end-stage renal disease, he'll need either dialysis or a kidney transplant. For now, he's stable, but he'll need monitoring for the rest of his life. Teddy still goes to the gym, he still watches his diet, but his cabinet of supplements is gone. All of them. He learned that optimization can become obsession, and obsession can become poisoning. More isn't always better. Sometimes, more is toxic. Your body is an elegantly balanced system. Millions of years of evolution have fine-tuned it to extract what it needs from food, sunlight, and environment. When we override those systems with massive doses of isolated compounds, we're not optimizing. We're disrupting. Teddy's kidneys will never fully recover, but his story might prevent someone else from making the same mistake. If you're considering high-dose supplementation of anything, vitamins, minerals, herbs, amino acids, talk to your doctor first. Get blood work, understand the risks, and remember, the dose makes the poison, even something as seemingly benign as the sunshine vitamin. Thanks for watching. If you found this video educational, please like and subscribe for more medical case studies. And as always, take care of yourselves and take care of each other.